You may not realize it, but every single day you're overcoming your own emotions. The mental strength you find to get out of bed in the morning, that's overcoming dread. The courage each of you, including me, has found to stand up here and give this speech, that's overcoming fear. You may not realize it, but all those conversations that you have with yourself in your head every day is therapy. It's just like walking into someone's office and offering them what's on your mind. In fact, that's exactly what it is. My name is Mackenzie U and I'm going to tell you about the journey into psychotherapy in ISM this year. So in ISM, we find information in two ways: research and informational interviews. These are just a few of the things I've researched this year. The first being cognitive behavioral therapy. Now this is the most common form of therapy, mostly used with anxiety, and this is the correction of negative thinking patterns. This takes the thought processes that some people have and corrects them to positive ones, like I can't do it to I can do it. This is a step-by-step process going through feelings, behaviors, outcomes, and emotions. It's most commonly used to treat anxiety. Anxiety is the most common thing walking into a therapist's office these days. And these thought processes are often habitual. People don't want to think negatively, but they do. And that's what cognitive behavioral therapy does, is it helps them think positively. And at the end of this process, oftentimes the validity of clients' thoughts are tested. The therapist will ask, so are you really not able to do it, or are you just thinking that you can't? Another thing I've looked into is play therapy. Now this is for young children, typically ages 3 to 12. And the main concept of play therapy is that children this young don't have the brain development to have an in-depth conversation like adults can, so play acts as their language and the toys are the words. The child takes control of the play therapy, they choose what they want to play with, and the therapist is either offered into play or they don't. And the toys can represent emotions from anger to happiness, and oftentimes what the kids choose to play with is actually what's missing from their lives. So if a kid may create a family setting, maybe they're missing that family setting at home. And through this, the therapist can help the child connect their emotions to the situation. One more I looked into is EMDR therapy, which is eye movement desensitization and reprocessing therapy. And this is most commonly used with trauma cases, such as PTSD with veterans. So when someone encounters a traumatic event, it pauses the processing in the brain. And EMDR allows them to target where that processing stopped and connect it to what really happened in the event. So this can be used with images, hand motions, and sound, and it's targeted to calm the person down, and it's really a moment of self-reflection of how the event's really impacting their life. So the other way that we find information in ISM is through interviews, and I did 7 interviews this year, so I'll only be sharing a few of them with you. My first being with Erica Meek. Erica Meek is with the Parkwood Counseling Associates, and one thing she taught me is that the key to being a successful therapist is to take risks. So right out of college, she decided she was going to intern at a psych hospital. And there she had to undergo self-defense training because of how mentally ill some of the patients were. Which really reminds me of my quote for ISM this year, which is, "Success is not final, failure is not fatal, it's the courage to continue that counts," from Winston Churchill. Erica works with patients and kids. She actually opened my eyes to the idea that when you're working with kids, you're actually working with the parents too. Oftentimes, parents will send in the kid for one issue, and then it'll be revealed that the issue is really something else. One unique thing about Erica is that she actually has a certified therapy dog named Huey, and she told me that having a therapy dog in her office lets the clients know that it's a safe place for them to be. Another person I interviewed was Robbie Heath from Kid Talk in Frisco, and she focuses on children, and she uses this with play therapy and art therapy. When I walked into the office, there were tons of playrooms in there throughout the building with sand trays, canvases, table for arts and crafts, and role-playing toys. The kids typically portray what's missing from their life, which I mentioned earlier through my research on play therapy. And most of the time, this is like a lack of relationship with their parents or pent-up anger, and they'll portray this through like foam swords or darts or play guns. And another thing Robbie told me is that boundaries with clients are really key. Specifically, she said that she doesn't let her patients text her after a certain hour at night. Someone else I interviewed was Ms. Patty Delmany, and she was by far the most experienced person I interviewed. She works with Crossroads Counseling, and she had been working in therapy over 30 years. She was really unique because she told me about her experience with homicidal clients. These clients would come into her office and they would bang on the walls, they would go out in fits, and one other client she had even had a panic attack and the ambulance had to be called to calm them down. All of this really worked to desensitize her in therapy, and that's really key. Just like Erica working with the psych hospital, there's really extreme cases, and then there's the more low-key cases like moderate anxiety and such. What I could see in Patty is after all her years of working, her eyes still lit up when she talked about her work, and I could really tell that the passion she had was what drove her to be a therapist, and she even told me that she's working on her PhD even though she's about to retire, which I thought was awesome. Someone else I interviewed was Ashley Howard, and she works with LGBT clients, which was something I hadn't really discussed with any of the other therapists I'd interviewed. She really exposed for me the need for therapy in the LGBT community due to all the controversial opinions surrounding it. A lot of people don't agree with what they believe in or how they live their lives, and that really affects their emotions, and so she really is protective over those clients. She actually started out as a middle school teacher, and the relationships that she built with her student, she found out were more of a passion to her than the teaching itself, so she decided to go into therapy. And another thing Ashley helped me with is the internship that takes place during and after college. And the internship to become a licensed professional counselor takes up to 4,000 clinical hours, which can last over a time of 2 years. And it's basically just like being a counselor, which I love, but you're allowed to work with a supervisor once a week, and you really get those guidelines to how you should be dealing with cases. So it really prepares you for the future. Now, the last person I interviewed was Kelly Hoxie, and she's actually my mentor for this year in ISM. And she works with Frisco Family Counseling, and she works basically with anyone, families, couples, individuals. And before she opened her private practice, she worked with severe divorce cases when working with schools, and she even had to appear in court for some of the students. And she told me that she would be driving home at night paranoid that a parent would be following her. So that kind of helped her desensitize herself going into private practice. And she works with pretty much anybody, and she told me that the nature of her job makes her kind of this moral keeper of her personal life whenever she goes somewhere, because she knows what it's like for people to deal with really harsh things. She also told me that it's important to take an objective look at a client. Are they coming into therapy because they need it or because they like that emotional bond? And what I hadn't realized is that some people have never had that emotional bond before, and when they develop that with a therapist, they may get better, but they may not want to let go of that emotional bond. One of the most important things she told me was, don't forget about the business side. So when opening your own practice, she had no idea that she would have to do things like advertising, billing, and scheduling. So she told me that I should take business classes in college because she wished she had done that. I'm fortunate enough to call Kelly Hoxie my mentor this year, and although we've only been together a couple weeks now, she's already put together so many opportunities for me to learn and is actively helping me in my original work. Now, my original work, the main focus will be concerning unhealthy relationships and date rape. I was intending on going down the suicidal path, but I noticed how broad that topic was and how talked about it already was, and date rape and unhealthy relationships is kind of an issue that's very prevalent in society, but no one's really talking about it. So I plan on making a website that encompasses some of the signs of unhealthy relationships and provides help for the community. And Kelly's work with individuals with relationship issues and couples together is already helping me accomplish this. I'll be working forward doing observations with Kelly and developing my skills as a potential therapist. Thank you.